Hey everybody, this is Erica. It's not a podcast release week, so we thought we would jump in every so often to give you guys just some clinical pearls to really help you hone in on your clinical reasoning and assessment, and really help you prioritize your assessment process. And I'm going to just give you a really quick example and a couple really important points about a new patient I've seen recently. He is a 19-year-old soccer player, quite a good soccer player actually, and he had complaints of right-sided low back pain. I'm just looking down at my paper here because I just saw him recently. Right-sided low back pain, was treated by somebody else for the pelvic obliquity. He kept saying he was out of alignment. Every time he did the classic muscle energy technique, he'd feel better short term, and then his pain would come back. So in his subjective, he said to me, he's like, I can run forwards and I can run backwards really fine. My back doesn't bother me. It's when I go side to side, like when he's on the soccer field, probably he's a midfielder, probably trying to guard somebody or dribble the ball. That's when his back bothers him. So what regions of the body would that be difficult for? If you think about it, right? What regions of the body have a hard time going side to side? Just think about head, shoulder, thorax, low back, pelvis, knees, hips, feet, and we'll hold that thought, but just think about it. Because he can run forwards in the sagittal plane, no problem. And he had a problem on a snowboard as well, which was, in that sort of side-to-side position, rotating and going down the mountain. So frontal and transverse plane, he had some difficulty with. He, in my objective, as well as a subjective, I always ask about, did you have any foot problems or any other injuries? He's like, yeah, I actually did have a foot problem. Many years ago, I had a right metatarsal fracture. He's like, come to think of it, that's when my back started bothering me. I'm like, yeah, go figure, right? So he had a major issue with his foot. He turned on it many, many times, he told me. So the region of the body, or the regions of the body that have a really hard time going laterally, are the foot. That's a hard thing for a foot to do. Lateral lunges, side to side, and your thorax. Less so because the thorax rotates and translates, right? So thoraxes, people have thoracic, where the driver's in their thorax, they have a little bit more difficult time side to side, but the foot has a much harder time, in my opinion, my clinical practice. So that should have clued you in right from the get-go, from his subjective. I have a hard time going side to side, but I can run. So his plantar flexion, dorsiflexion was fine. He definitely had weak calves for sure. Not surprising for a young 19-year-old, right? So that should have clued you in right there. Worse with lateral movements. When I took a look at him in standing, his center of mass was way to the left. I literally stood behind him, put my hands on his pelvis, married my feet to his feet, normal stance, and I literally just shifted him, and then I just let go and he went way to the left. Makes sense. He had right-sided low back pain. He offloads that side, but he also had a right foot injury, and he probably has been offloading that for a long, long time. Okay, your right side loses options. It's like that cortical smudging that David Butler talks about. You lose options for movement. He needs to get back on his right side. No wonder lateral movements bothered him, because he had no options for movement on his right side. So when I did the assessment, ultimately his main issues, or his pain generator, was obviously something in his lumbar spine. He had a pars fracture many years ago. That was the pain generator. But ultimately his main issue were the drivers, were his foot, and he had a loss of thoracic control. He could not center himself without losing control in his trunk. So the clue is, when you have somebody's center of mass, they're way over to one side, his case the left, look at the opposite foot or the opposite side for any kind of past movement history, past injury history, and then think about what they're telling you in their story. Okay, I hope that helps. Bye.